The warning signs of skin cancer. What everyone should know. Skin cancer is the most common form of cancer worldwide. It develops when abnormal skin cells grow uncontrollably, often as a result of long-term exposure to ultraviolet, UV radiation from the sun or tanning beds. The three main types are basal cell carcinoma, squamous cell carcinoma, and melanoma. The good news is that skin cancer is highly curable when detected early, so recognizing the warning signs and getting regular skin checks is essential. Precancerous warning signs. Actinic keratosis, solar keratosis. These are small, rough, scaly patches that develop after years of sun exposure, often appearing on the face, ears, scalp, neck, and hands. They may feel dry or gritty and can range in color from pink to brown. Actinic keratoses are not cancer, but are considered precancerous, as some may progress to squamous cell carcinoma if untreated. Fair-skinned individuals with light or red hair and blue or green eyes are most at risk. Actinic cheilitis, farmer's lip. This condition affects the lower lip and is caused by chronic sun exposure. The lip may look dry, scaly, swollen, or lose its defined border. Without treatment, it can develop into squamous cell carcinoma. Cutaneous horn. A cutaneous horn appears as a cone-shaped or horn-like growth made of compact keratin, the same protein found in nails and hair. It usually forms on sun-damaged skin in older adults. The base of the horn can sometimes contain cancerous cells, so professional evaluation is important. Changes in moles or new growths. When is a mole a concern? Most moles are harmless, but abnormal moles or atypical, dysplastic nevi can sometimes develop into melanoma, a serious type of skin cancer. Warning signs include irregular shape or uneven edges, multiple colors in one mole, growth larger than a pencil eraser, rapid changes in size, shape, or color. It's unusual to develop new moles in adulthood. Any new or changing mole should be checked by a dermatologist. The ABCDE rule for melanoma. Learn this easy guide to spot potential warning signs. A. Asymmetry. One half of the mole looks different from the other. B. Border, irregular, blurred, or jagged edges. C. Color, multiple shades, brown, black, red, white, or blue. D. Diameter, larger than 1/4 inch, about 6 mm. E. Evolving, changes in size, shape, color, or new symptoms like itching or bleeding. If a mole or spot fits any of these characteristics, schedule a professional skin exam promptly. Types of skin cancer: basal cell carcinoma, BCC. The most common and least aggressive type. Appears as a shiny bump, open sore, or scar-like patch. Caused by long-term sun exposure. Rarely spreads but can damage nearby tissue if untreated. Squamous cell carcinoma, SCC, appears as a red, scaly bump, crusted sore, or thickened patch that doesn't heal. Found most often on sun-exposed areas like the face, lips, ears, or hands. Curable when treated early, but can spread if ignored. Melanoma. The most dangerous form of skin cancer. Develops in pigment-producing cells, melanocytes. Can spread quickly to other organs if not caught early. May appear as a new dark spot or a changing mole. Bowen disease, also called squamous cell carcinoma in situ, appears as a red, scaly, crusted patch that may resemble eczema or psoriasis. Can progress into invasive cancer if untreated. Kaposi's sarcoma. A rare form of skin cancer that develops in people with weakened immune systems, such as AIDS patients. Appears as purple or dark lesions on the skin, often on the feet or legs. Requires medical attention immediately. How to protect your skin. Apply broad-spectrum sunscreen daily, SPF 30 or higher. Avoid sun exposure during peak hours, 10 a.m., 2 p.m. Wear protective clothing, wide-brimmed hats, and UV-blocking sunglasses. Avoid tanning beds entirely. Perform monthly self exams and schedule annual skin checks with a dermatologist. Early detection saves lives. Most skin cancers can be treated successfully if caught early. Regular monitoring of your skin, especially new or changing moles, spots, or patches, is your best defense. If you notice anything unusual, see a dermatologist for professional evaluation. Your skin's health depends on awareness, prevention, and early action.